there, Bridget.
Hi, Sarah.
Hi, good to see you. Can you see me okay?
Yeah, you're pretty clear.
It's really nice to see you again. How have things been going?
Yeah, a little bit better since the last time I saw you. A little bit.
So, Bridget, when I saw you last week, we spoke about a diagnosis of depression, and we talked about referring you to a psychologist then, and sort of just touched on some of the other treatment options. How have things been going since then?
Yeah, good. I have an appointment in a couple of weeks to go see a psychologist, so that's really good.
Oh, great. Well done. Look, I was hoping for us to talk about some of the medication treatment options today. Would that be all right?
Yeah, that'd be good.
Okay, great. So, look, it is important that you understand what we talk about. And if it's okay with you, I'll just be checking in as we go to make sure that you've got the information. Is that okay?
That would be good, actually. Thank you.
So, we talked about psychology therapy, and today I'd like to talk about the medication treatment for depression. So there's two different ways we treat depression, which is through psychology therapy and medications, and I suggest people use both of those things at the same time. So what we use are things called antidepressant medications. Now, there's many different types of antidepressant medications, so we can be really flexible with options. Let me know if you think the treatment we're using isn't working for you, okay? What I'd suggest we use is something called a selective serotonin reuptake inhibitor, or in short, an SSRI.
I'm not going to remember that name.
That's okay. SSRI is fine. Okay. What this medication does is it increases the level of serotonin or happy chemicals in the brain. Now, it doesn't change your personality. And it's not going to suddenly flick a switch and make you happy. But what it should do is increase what your mood is feeling and maybe give you a bit more energy. And that helps you keep going with everything you need to do whilst you're working with a psychologist. SSRIs do take a few weeks before you start to feel a change, and at least 6 weeks before you get the full benefit. And it is important to know that different people react differently to the medications. So it is important for us to keep monitoring and see if we've got you on the right medication to give you the best benefit. Just to check I've explained properly, are you following so far?
Yeah, I think so. So SSRIs, kind of give you a happy chemical, and it might take up to 6 weeks to work.
Yeah, absolutely. And don't feel like they're going to change your personality or suddenly flick a switch. Okay?
Yeah.
And do know that we've got lots of flexibility in treatment. Okay. What I'd suggest we start with is a medication called fluoxetine. That's a type of SSRI and it's really commonly used. What we'll be aiming for is a dose of 20 milligrams in a tablet that you take in the morning. Now, when we start using these medications, I usually suggest people start with half a dose in the morning just to reduce the amount of side effects. And then after 1 week, go up to a full dose. So again, just want to check I've explained things clearly to you. How would you explain to someone else that how you're taking your medication?
So I'm taking fluoxetine. And it's 20 milligrams in the morning, but I only take a little bit of that for the first week to make sure the side effects are okay.
Yeah, absolutely. So just half a tablet in the morning for 1 week, and then a whole tablet in the morning every day after that.
Yeah.
Okay. Would you like a handout about fluoxetine?
Oh yes, please. I'd probably forget some of that.
Every medication will give you some side effects, but it is important for you to know what to look out for. Now, in the first week, people might experience nausea, dizziness, headaches, sometimes some anxiety or agitation. Now, these usually settle down in the first week. Okay. Longer term, people can experience weight gain or difficulties with sexual function, such as a loss of libido. Occasionally, one of the more serious side effects is that people can actually have suicidal thoughts pop up, and that's because of the medication. It's not because of the depression. Okay. But it is really important that you can tell me if the medication's causing any of these side effects, particularly if they're bothering you, or particularly if they are suicidal thoughts. Okay. How would you know that there might be a problem? Can you think of anything that might trigger?
Nausea, maybe trembling, sweating, maybe, weight gain.
Yeah.
Lower sex drive. And if I start feeling like I might be suicidal, yeah.
Do you know how might you sort of reach out or talk to me or someone else if you needed to?
Yeah, so I can call you and tell you that the medication might be the cause.
Yeah, absolutely. And look, you can also talk to a family member or a close friend if you are in trouble at the time. So look, Bridget, today we've sort of talked through again what depression is. We've talked through the treatment options, psychology, and also medications. We've talked about the medication fluoxetine, how to start using it, what side effects to look out for. Do you have any questions at all about what we've gone through?
No, I think I've got all of that.
Okay, great. So look, we'll see you in a couple of weeks.